Hello and welcome to our first ever 5-minute blog summary. So for those of you who don't have the time to read or the option to do so, these videos are here to give you a quick snapshot of the main take-homes for the blog. This last blog here was basically on all of the questions related to exercising with cancer, some of the top questions I've gotten over the years, and just trying to create a summary for you guys. So here's the blog here, and you can find this on thecancerphysio.com. And the main thing that we're trying to focus on here is rehab tools and ways to exercise that are safely, but also effective in the realm of exercise as medicine. Most people would know that when you have cancer, we know exercise is medicine. We know we need to be moving more, but there's a lot of questions around that. There's a lot of confusion. Sometimes there's also symptoms that can be burdening, like dizziness or fatigue. You tried exercise and then you crash for 3 days, or maybe you feel lightheaded, maybe there's pain that gets in the way, and there can be a lot of barriers. So we try to break some of that down by providing rehab support, but more so this blog is just to answer any questions you have relating to exercising with cancer. Symptom burden, right here you can see, is a term we use a lot on the website, and that is to put into words everything that patients experience as a side effect from cancer treatment. That can be a burden, that can make everything difficult. Cancer treatment side effects would be another way of putting that into words. And that is why sometimes exercising with cancer can be very difficult, because symptom burden is a very real thing. Things like chemotherapy-induced neuropathies, as you see here. I have a blog that goes into that on detail. Or managing, the side effects of hormone treatment. Or surgical complications, or so on. Lots of potential symptom burden. So one of the first questions that we get asked often is exercising with cancer safe? Well, we know it's recommended, but for a lot of patients, it doesn't feel safe. It feels hard, it feels intimidating. They have no energy for it, especially if you're in the thick of treatment, such as chemotherapy. So this part of my blog here goes into detail about, is it safe to exercise with chemo? Overall, we have learned that yes, it is. Some chemotherapies can have some cardiotoxic effects, so you should be tracking some simple vitals. Things like blood pressure, complete blood counts, your general heart rate, your overall feeling of malaise are all kind of indicators that you can use to decide whether you're exercising that day and how hard. So I've created these guidelines here, safe cancer and exercise guidelines. This is all courtesy of some of the best researchers in this area. The BC Cancer Agency as well has this on their site, and I've just summarized a bit in my own words here. But basically, you should be looking at your basal temperature. So if you're in the thick of treatment, are you running a fever? And if you're running a fever, you probably should keep it very light that day. You should know where your hemoglobin levels are, your neutrophils, which is your white blood cells, your platelets, and there's certain markers here that indicate that it wouldn't be safe for you to work at higher exertion. It wouldn't be optimal stress. So these are really good guidelines to go by. Or if you have angina, which is heart pain or chest pain, or any severe nausea or dizziness that day, also likely that you will keep it quite light. With chemo, there are cycles, and they are called nadir, and so there's a period of time after your infusion that there's a change in your overall blood count. This usually correlates with feeling quite fatigued, quite crummy, and so on. So you'll start to learn these cycles, and you'll start to kind of see how your body is and be able to gauge how you want to exercise, if you want to exercise during those times. But obviously exercising during treatment and in the thick of it, such as chemotherapy, is difficult. And so you aim for just consistency and a bit of maintenance without setting a lot of goal and a lot of expectation. Do you need medical clearance to exercise? What if you've had surgery recently? Well, usually surgeons will give you a post-surgical protocol. Maybe they'll say no movement for 2 weeks, or no heavy loads, or no lifting more than 2 pounds. The biggest thing with post-surgery is wounds, so you want to watch the wound. You want to make sure that the wound is closing, that it looks healthy, there's no signs of infection, because ultimately movement and increasing your heart rate will increase the stress and the pressure on the wound. So we just want to make sure that we're not doing too much too soon. So there's certain kind of things you would want to watch for in terms of how the wound is doing, and just kind of keeping your eyes on it daily. Usually week 0 to 3 post-operative is very, very gentle, light movement. So when should I avoid exercise? What indicates that I should stop? There are certain circumstances that exercise isn't medicine, believe it or not. And we talk a lot about exercise as medicine, exercise with cancer, it's a great thing. And it is, but with any pendulum, we don't want to swing it too far, and we want to be rational about it. And we know that there are things like fevers and viral loads, infections, elevated nausea, certain blood pressure dysregulation, fatigue that's worsening. And this indicates that maybe something about the exercise that you're doing isn't quite right. The dose, the intensity, the type, the timing, doesn't matter. But it means you probably need some professional help from a cancer physiotherapist or an exercise physiologist who specializes in cancer and exercise. But there are times that you should potentially not be exercising. And those are examples of that. There are termination guidelines by the ACSM. And that's where you obviously see a recent cardiac event. You have severe aortic stenosis. There is maybe some uncontrolled angina and chest pains and an acute systemic infection. These are just examples of where you really shouldn't be elevating your heart rate a lot. And you can consult more on my website for those exact details. Another really common question is, what if I'm cleared to exercise, but keep experiencing worsening fatigue? And this is very common. We call it push-crash cycling. Well, prior to exercise, you always want to measure your vitals. It's a really good habit, heart rate and blood pressure, and start using something called rating of perceived exertion. This is how hard you feel like you're working. This is your best tool and your most powerful indicator. Your heart rate could be very low, but you feel like you're working out a 7 out of 10. And if you feel like you're working out a 7 out of 10, that's what matters, not the heart rate. So you really should get used to measuring your vitals, but also trust yourself in that the RP is your most reliable indicator. And so we use that to start to try to find that 3 or 4 out of 10 for people who've been diagnosed with cancer-related fatigue. Whether or not you have that diagnosis, I don't know. It's something else we support with here at the Cancer Physio, but we can hopefully work together to get you an exercise plan where the fatigue isn't worsening and we don't see that push-crash cycling. So how much is recommended with exercise and how intense? Well, the general guidelines are that you should kind of increase slowly up to 150 minutes per week, that you should aim for about 2 strength training sessions. These are the guidelines. I don't worry too much about this because I feel like depending on your phase of treatment, sometimes this is realistic and sometimes it isn't. I would say that after you're done treatment and you're in the recovery phase, as I call it at the Cancer Physio, that's where we can talk more about kind of goal setting and setting these standards and sticking to them. And then even more so when we're trying to get back to active living or return to work. But in the treatment phase, I think any little bit of exercise that gets done is good. And of course, we want to aim for 150 minutes per week, but realistically, that doesn't always happen. So what we want to aim for is something that's realistic and consistent, and that's very personal for everyone. And I help patients establish those goals. On my website here, you will see a rating of perceived exertion breakdown. And this is where we talked about you kind of learning how to judge how hard you're working yourself. This is your best friend, your most powerful tool, your most reliable indicator. And this is how we kind of start with learning that kind of moderate to light approach when you are diagnosed with cancer-related fatigue, which isn't everyone, but the RP scale is really useful regardless of diagnosis. What type of exercise is recommended? Well, once again, we have certain guidelines of strength training, resistance training, and aerobic training, and that's what the guidelines say. But even in the regular world and realm of exercise I work in, I always say the best exercise is the one that gets done. So really what we want is consistency, and that might look a little different for every person. For some people, that is training with weights. For other people, that's load through the system through something like yoga. Obviously there's pure definitions to what strength is and what aerobic training is. We can set more specific goals when it's realistic to do so. But to start, I would say what's recommended is some form of load to the body and some form of getting your heart rate up a little bit. And we just try to keep it a little bit simple like that here at the Cancer Physio. People always ask, is a cancer physiotherapist / cancer exercise specialist necessary? Well, in all honesty, it's a very case-by-case basis. I've worked with people that are having little to no symptom burden, have a great athletic background. I teach them RP. I tell them kind of the guidelines as to when they should exercise and not according to blood counts, blood pressure, etc. And they are very safe and independent to guide themselves, and I don't see them again. However, there are other people with more complex diagnoses, an absence of exercise background, and I think it isn't safe for someone like that to try to just self-guide. I think that there are supports available, and some people need to reach out. So it's a case-by-case basis, but if you're struggling with that question, on my blog here, I kind of go into a little bit more detail as to when, cancer physio might be useful. So some of the other questions we kind of get asked a lot is questions like, what limitations might I expect? What symptom burden, might I expect? Often it's fatigue and pain, I would say, are the most common. Believe it or not, it's not lymphedema. The most reported symptom with, I think it was about a case study that involved surveying 6,000 different patients with breast cancer, joint pain was the most common symptom reported. So often fatigue and pain, very kind of common general symptoms, are the biggest burdens to exercise. So we talk a lot about that. We diagnose that if there's something more specific going on there. Sometimes there is. In the case of breast cancer, you might have something like cording or a stiff frozen shoulder as an example. But sometimes it is just merely joint arthralgia as a side effect of treatment. That can be common. So we teach patients tools to understand how to exercise safely around these diagnoses. One of these tools I like to call is the sore but safe. And I talk about this, 10 times a day. Sore but safe is a way to gauge if what you're doing is healthy and manageable for your body. So if you feel a pain or you feel a symptom, like a sore shoulder, you rate the pain out of 10. You then observe the pain and your function for the next 24 hours, okay? And if your function or pain got worse, you go back to that activity and you half it. So you just make it less intense, or you do a smaller dose. You don't say, I can't do that activity. You don't avoid it. We just change it to try to find that sore but safe. So we're constantly kind of observing, evaluating, and reflecting. And that process takes time, but through that you can find the sore but safe. I just want to stop and take a moment here and just once again emphasize, that the Cancer Physio offers personalized cancer rehab, and this cancer rehab is driven by care for people and science. We offer cancer rehab supports and tools that work through all 5 stages of treatment. You can read about this more at thecancerphysio.com. So to finish here, what are the benefits of exercising with cancer? I think this is trending. I think everyone's hearing about this. It's making everyone kind of talk about how exercise is medicine. It's very exciting. I hope if there's anything you take from this blog today is that exercise is indeed medicine, but there are some guidelines and tools around that to ensure that's safe and effective. Well, we know that exercise is medicine and that it actually makes treatment more effective. We know that it improves well-being, it reduces depressive symptoms, it provides a sense of power in a powerless time, it helps with memory and attention. When it's consistent, it can help boost immunity. Exercise reduces treatment side effects such as fibrosis, fatigue, pain, and stiffness. Exercise lessens the complications of musculoskeletal pathologies or the likelihood of. If you keep your shoulder healthy and moving, you will be able to get into the position for radiation. We know that exercise minimizes the chance of falls. It decreases the chance of cancer-related fatigue or long-haul cancer syndrome, as I like to talk about it. Exercise supports a successful return to work, which is a realistic outcome for a lot of people. Exercise supports returning to sport more efficiently and getting back to the things you love. It improves longevity, it can reduce tumor growth, and exercise promotes survivorship. So I think we'll end on that note, and I hope this 5-minute summary was useful for you. Thanks for tuning in, and thank you for your interest in rehab and science.